So ladies and gentlemen, today I'm going to show you tell you the five letters that would heal your pressure ulcer, what we call pressure injury. First is the letter P, which is pressure relief. It doesn't matter what you do, if you are not removing the pressure, your pressure ulcer will not heal. The other one is the letter D, which is debridement. You need to debride the wound. You need to remove all the vitalized non-viable tissues in the wound base or at the wound edges. And then next one is the letter I, which is infection or inflammation. You need to treat infection or inflammation because infection or increased bioburden would compete with the nutrition of the growing tissue. So make sure that infection is controlled or eradicated, and also chronic inflammation has to be controlled as well, because in the inflammatory response will produce a lot of those enzymes that would destroy collagen or connective tissue. You need those in order for you to grow the granulation tissue to fill the gap in order for your wound to heal. And the other word is the letter M, which stands for moisture balance. Make sure that the wound is not wet and it's not also dry. It has to be at the middle. I did not say wet, I said moist. The wound base has to be moist, just like your you have to moisten your plants in order for those plants to grow. Once it is dry, what's gonna happen is your plants would die. So you're gonna form scab and it's gonna delay the healing process. So don't you know that if you have a pressure injury with this stage 3, right? It's a full thickness, meaning to say that the whole depth or of the skin is affected, like the epidermis and the dermis. Those are the two major layers of the skin. So once they are affected, we call it stage 3 or full thickness. So the only way that you would heal that is first you have to grow a granulation tissue to fill the gap, and after that, okay, you have to grow epithelial cells or tissue at the edges of the wound. Little guys should migrate in a leaf frag manner going to the center. They gotta meet at the center in order to resurface the wound. They can only do that in a moist environment. They cannot migrate in the desert. Just like saying the caravan cannot migrate in a dry environment. There is a caravan of new tissue, new cells. We call this epithelial cells that will be moving from the edges of the wound to the center. They're gonna meet there at the center, and when they meet one another, they will stop migrating to the phenomenon we call it contact inhibition. In that way, you don't form a lot of scars or tumor, whatever. So actually, contact inhibition is one of the ways of our body in order for us to arrest growth of tissue when it's no longer needed. So the last one is the letter E, which is the edges. If you have a wound, if you are a clinician and you're assessing a wound, the edges of the wound will tell you a lot of things that you needed to know. You know if this wound is chronic, you know when the wound is acute, and you would know if the wound would close soon. If you see a pebbly, what we call a curling in of the edge, the wound is not gonna close. If the edge is not attached to the base, okay, the wound is not ready to close as well. So what else? Sometimes there are some tissue in there. It's just hanging within the edge of the wound, and this tissue, we call it senescent tissue, or if you look at it in a So if you are looking at in a more microscopic level, we call them senescent cells. So what are these senescent cells? These are cells that are not actually gonna do anything. They are just there. They are not going to differentiate into a different type of cell. They are not gonna differentiate into a keratinocyte or epithelial tissue or something like that. They are just there. So they are useless, okay? But they are useless, but they do obstruct the migration of epithelial cells or epithelial tissue. So therefore, those edges needs to be clear of senescent cells, or what we call senescent tissue, okay, to be more appropriate for the naked eye. So I hope you learned something today. Always remember P dime. P stands for pressure relief. So if somebody asks you like, how I have a pressure ulcer in my butt, how do I treat it? So the first thing that I say is, number one, remove the cause, which is pressure. Anybody who is trying to treat you and they are not managing the pressure, they are not thinking about what type of support surface that I should be using, what type of bed or mattress, or if you are wheelchair bound and they are not managing the pressure in that wheelchair, the treatment is substandard, or the treatment is a sham, meaning to say that you are not going to solve a problem if you are not removing the problem, which is the pressure. Okay, and then let's go ahead and take a look on the wound. Letter D, debridement, removal of necrotic tissue. Letter I, which is if there's infection, you need to treat that. And then letter M, make sure that you have a moist healing environment. You need to cover your wound. Do not believe on other people's idea that you need to air dry. So that concept is, we have to bury that, okay, here in the soil, okay? No more concept of we need to air dry the wound. That is long time ago in the galaxy far away. So leave that concept, okay? And then so it has to be moist. You have to cover when it's an open wound. The only time when you don't have to cover is when the wound is already resurfaced. And then letter E is take a look on the edges. So make sure that the wound is, or the edges of the wound is attached to the base, because otherwise if they are not, and the granulation tissue or the base keeps growing, it will go beyond the level which we call hypergranulation tissue, and that's also one of the delaying factors, or one of the factors why your wound is not healing. I hope you learned something today. This is Dr. Saturn. I'm a physical therapist and a wound care board certified wound care specialist, and also I'm certified in the area of lymphedema. Talking to you from the Joshua National Park here in the United States. God bless.